Dialectical Behavioral Therapy is a therapy that was developed in the 1980s by Marsha Linehan. It's a combination of cognitive behavioral therapy with Zen Buddhism. The Dbt Clinical Pathway at Lifeskills is a 13-week curriculum. When we do it in outpatient, we usually do it over a period of a year, but we've condensed it to the 13 weeks for residential. So we have 3 groups per week on the Dbt Clinical Pathway. That would be Monday, Wednesday, and Thursday. So on Mondays, we go over the homework from the last session. On Wednesdays, the new skill is presented to the clients. And then on Thursday, the whole group is dedicated to mindfulness. That adds up to 3 hours per week for Dbt. And then on an outpatient basis, which is the traditional structure, they recommend 2.5 hours once per week. At Lifeskills, we have a comprehensive Dbt program. In order for a program to be comprehensive in regards to Dbt, there has to be skills training group, individual Dbt therapy, phone coaching, and a professional consultation team. On Fridays, for 90 minutes, all of those who are intensively trained or certified meet together, and that's the consultation team piece. Then the phone coaching is available to the clients 24/7. They have the ability to call the Dbt therapist. Then they would be able to ask them what skills they've already tried and coach them on some skills that they can try if they're in a crisis situation. We also have the skills training groups, which meet 3 times a week. And then we have the individual Dbt therapy, which is a very structured individual therapy session that targets the client's specific target behaviors. Dialectical is the basis of Dbt. Dialectical means the balance of opposites. The main dialectic that runs through Dbt is acceptance and change and balancing those things. There are 4 modules to the Dbt curriculum. 2 of the modules are acceptance-based and 2 are change-based modules. Mindfulness and distress tolerance would be our acceptance-based modules, and then emotional regulation and interpersonal effectiveness would be the change-based modules. In the 13 weeks, we go through all 4 of those modules. The people that benefit from Dbt would be basically anyone. Originally, the research was done with chronically suicidal females, and then it became known as the therapy of choice for borderline personality disorder. Since the 80s, there have been multiple studies that show that it's effective with all personality disorders. It's one of the only treatments that is effective for antisocial personality disorder specifically. It's shown a lot of promise with PTSD, panic disorder, eating disorders, and affective disorders, meaning depression, bipolar. There's basically no group that would not benefit from Dbt.